We have a very diverse group coming together on this call, which is fantastic. It's exactly what we were hoping for, is to really be able to bring people together outside of the committee work and outside of any of the other work groups or parts of this initiative. So, well, I have 2:02 on my computer clock, so I'm going to go ahead and get started and say welcome to everybody. This is our first coalition conversation. My name is Alice Bonner, and I'm the chair of the Moving Forward Nursing Home Quality Coalition. We have a few people who are co-facilitating with me today, and I'm actually going to invite anybody else who wants to do that to jump in. But before I set us up for this call and talk about the purpose and what we want to get out of it, I would love to just turn it over for a moment to Terry Fulmer, President and CEO of the John A. Hartford Foundation. Terry, if you want to just welcome people and say anything that you'd like about the Moving Forward Coalition so far.
Thank you, Alice, and thank you all for joining us. We have come through a very difficult time with COVID, and we have seen the worst that can happen in nursing homes in our country and around the world. And our foundation is dedicated to improving care for older adults, no matter where they are and no matter who is providing the care. In that moment, we made several emergency grants. One was to the National Academies to complete their report on quality and safety in nursing homes. We worked with Frameworks on a document called Reframing Nursing Homes, which is a wonderful way to think about how we talk about nursing homes. The Brookings Institute, and now gratefully with Leading Age and Alice Bonner. So Leading Age is now taking the report, moving it forward, and we will not be able to do this without all of you staying with us, being critical of the work, examining where we are making progress and where we need to shore it up, and just staying the course. And if at any point you feel like, I don't know if this work speaks to me, give me a personal call and I will figure out how to do everything I can to keep you with us so that we get where we need to be, which is excellence in care for older adults in these settings. Go ahead, Alice.
Fabulous. Thank you, Terry. Just going to introduce a couple of other co-chairs of committees who are with us here today. So Penny Cook, would you like to introduce yourself, please?
Sure. Thank you. And thanks to all of you for being here. This is exciting. I agree. It's such a broad group of people that we have here. So I'm Penny Cook. I have been the president and CEO of Pioneer Network for the past 5 years. And a few months ago, Pioneer Network created an alliance with the Greenhouse Project. And I'm very happy to be representing both organizations. I am also one of the co-chairs, along with Susan Ryan from the Greenhouse Project and Tatiana Shippey of Committee Number 1. And Committee Number 1's goal is to ensure that we're providing person-centered, equitable care. And so I'm really happy to be here and representing the committee. I will also say I am the co-chair of the board of Advancing Excellence, since I see that Jay Sackman is on the call as well. So it's great to be here. And again, thanks to all of you.
Wonderful. Thank you so much. And Penny just raised a really important point that we talk about a lot within the Moving Forward Coalition and the steering committee, which is we are trying very much to build on existing work and emerging work that all of you are already doing. And you tell great stories on our calls, and we're learning all the time. But that point about other organizations that are doing this work, it's a very central tenet of what we're doing to, raise all boats here. If other groups are doing work that's very closely related, we want to support and really help to build on that work, as well as have them build on coalition work. So great. Thanks, Penny. Greg Alexander, would you like to introduce yourself? We have Greg, who is co-chair of Committee Number 7 on HIT. So Greg, go ahead.
Well, thank you so much, everyone, for being here. I'm Greg Alexander. I'm a professor at Columbia University in the School of Nursing. I was on the NASM committee that helped write the report. I've spent the last over 20 years working in nursing homes, trying to improve quality of care through the use of informatics, and focusing on how technology can help improve quality of care in nursing homes. That's what Committee 7 is, and Recommendation 7 in the report addresses. So I've worked with several people on this call that are here today on improving long-term care with health information technology. And so I look forward to working with you on across committees and on our committee specifically. Thank you very much.
Awesome. Thank you. And I see that Terry O'Malley has joined us also from committee number 7. Terry, do you want to introduce yourself? Oh, you're on mute.
Technology. Okay. So I'm a retired geriatrician, have done a fair amount in health informatics over the last 10 years. Spent most of my career taking care of patients in nursing homes, and then have spent a lot of time thinking about how to improve the exchange of information during transitions of care. So Committee 7 is poised to help a little bit on that, but we're going to need a lot of help from a lot of people to get it moving. So look forward to working with you all.
Absolutely great. Thank you all for introducing yourselves. And I just want to also point out that in addition to Terry Fulmer, we have Jane Carmody and Nancy Wexler from the John A. Hartford Foundation that is, generously funding the 2 years of this initiative. So we're very grateful to have them on as well today. We don't really have time to go through everybody individually introducing themselves, but I see a lot of people have chatted in, your name, your affiliation, or the reason that you want to be involved and be on this call today. And that's really what we want to hear from you. For some of us on this call, a lot of us, we've already been on a lot of either committee calls or steering committee calls or planning calls and subgroup calls. And so we don't want to just go over those things again. However, we also want to make sure that we're grounding people in the basic work of the coalition. So I guess I would just ask if we have some slides that are available. I think most people on this call have probably seen them in different settings. So I don't necessarily just want to go back to slides. And I kind of like the idea that, what we can do is really talk with one another. So let me give a little bit of framing, and then, please, put in the chat if you really want us to give more background on the coalition. So I think people are familiar that the National Academies of Sciences, Engineering, and Medicine came out in April with their report that was the national imperative to address nursing home quality. And in that national report, 600 pages, were a set of recommendations, and there were 7 categories of recommendations, large categories like person-centered care and culture change, workforce, etc. And so we formed a coalition, and we called it the Moving Forward Coalition. And the purpose was to bring together organizations like a lot of your organizations that are already doing this work. You heard Penny and Jay mention about advancing excellence. I see we have representation from GAPNA, the Gerontological Advanced Practice Nurse Association. I see we have representation from NADANA, Directors of Nursing and Long-Term Care Association, and a number of others. And so please feel free to chat in if you want to just mention specifically a professional association that you're working with, because we have Ariadne Labs representation here as well. So the purpose of forming a coalition was to say there's so much good work happening, but it's a little bit fragmented. Not everybody knows what each other is doing. And instead of continuing to work in silos where we're at risk for duplicating or having continued gaps, let's bring people together so we can actually listen to one another, really hear each other, and come up with a set of not just priorities, but priorities that we will turn into action plans. And I was sharing at the beginning of the call with a couple of colleagues that yesterday I was on a panel at the Consumer Voice Conference, which was in Baltimore, Maryland. And a number of you may be familiar with Consumer Voice. They work with the Long-Term Care Ombudsman program and Resource Center. They have a lot of family members and nursing home residents who are part of their organization. And again, the ombudsman was sort of the dominant group in the room. And it was a packed room that, we were speaking with probably over 200 people. And it's an example, I think, of really needing to say to one another, not every organization is going to jump in with both feet because they may not see themselves as having an important role, and they want to be respected. They want to be heard, and they want to have a role. So I was able to engage and have a number of conversations with Ombudsman about their role in moving forward, and talk about how we have representation on, many or most of the working committees, and representation on the steering committee, et cetera. But I digressed a little bit here. So we've come together to create action plans that are based on the priorities that the committees have set. And good news is that, we've accomplished a number of things that we said we wanted to do right in the beginning of this work. We wanted to convene people. We've hit all our milestones for that, although we are continuing to encourage people to join. We have about 500 people who've signed up and said, I want to do something. I'm not sure what, but I'm in. And so we're continuing to add to that list. And a lot of those people have subject matter expertise, or they have lived experience. I know we have people on this call today who are currently living in a nursing home, and maybe, one or more of them would like to share a story or tell us about some of the things that they would like to see us focus on in terms of improving quality of life. So we have all of those folks signed up. We have about 60 organizations. So I mentioned a few of them, but we have about 60 altogether. And after the convening phase, the committees have started to meet. They've had at least a few meetings, but not a huge number, because they just started meeting in September. So for those of us on this call, we want to remind ourselves, we are very early in this initiative. This is only really been up and running for a few months. The other things we did in the very beginning were we built a website, a brand new website from scratch, pretty much, with our communications company and with the John A. Hartford communications folks. So, that was another piece of work. But now the website is accessed quite a bit, and we have resources there and updates and so forth. So we will absolutely, encourage you to go to the Moving Forward website. If you Google Moving Forward Coalition, it will most likely be the first hit that you get in your search engine. So we would encourage you to go there. And in addition to the committee's meeting, they have just now, as of Friday, posted a 1 or 2 page overview of the priorities that the committee members have said. These are the top 1 or 2 things that we want this committee to really focus on in our action plans. So that's been a big part of the work over the last couple of months. And now that we have those and have sort of hit that milestone, now we really want to move into the next phase, which is that early action planning. So, one of the things that we would love to know from you today, thank you, Nancy Wexler, for chatting in the link. Perfect. Terry Fulmer might want to, talk about this as well, but I will tell you, we talk about this issue pretty much across all of the committees and folks. We have all these people, as I said, 500 people who've said they want to do something. They want to be involved in the action. We have not to date had a lot for them to do. We've done one-on-one sort of calls with them. We've invited them to conversations, but in terms of actually rolling up their sleeves and, for example, being part of a work group, or working closely with a committee or the co-chairs, or drafting a document, reviewing a document. I'm just throwing out some of the ideas here that you might be thinking about as well. But we want to consider how we can really engage subject matter experts, people with lived experience, in a very meaningful and also equitable way. Like we've said from the very beginning, we don't want this to feel like it's a group of researchers. And I know a lot of us are researchers, or have been, and that's wonderful. And you're incredibly valuable. And it's also valuable to have clinicians, nurses, physicians, certified nursing assistants, other clinicians. And it's absolutely vital that we have the voice of nursing home residents, family members, care partners. And a lot of the people who've come, and become involved in this work have talked about caregivers and care partners and family members, and how we don't do enough in nursing homes. I've been one of those family members. I know we have people on this call because I recognize you and have, heard you talk about this. So we want to be sure we're acknowledging, and more than acknowledging, we're really recognizing what people bring to the table. So I probably already talked way too long, but I will say, this is where we're at now, is we're poised for this next phase of work, which is taking the priorities and starting to formulate them into early action plans or action plan outlines that we'll continue to build on. So before I turn it over to the group, let me just ask Penny, Greg, Terry, O'Malley, any thoughts from you guys about the committee work? Anything you want to add to what I said, which was just really high level?
This is Penny, and the thing that I would add is just to echo something you said, Alice, and that's that, I know for our committee, and I'm sure that Greg and Terry can chime in on this as well, we're really looking for everyone's input to help us shape what our recommendations and action plans are going to be. We only could put, a certain number of people on the committee so it wasn't huge, so that we could be effective. But we're looking for various ways to get all of the input from you and others so that we can really try to be as effective as possible as we create these action plans to move forward. So I just want to echo what Alice said. Your voice is so welcome for all of us.
Thank you. It was great. Greg or Terry, anything else to add about your work? And you guys have a lot of work groups where you've really thought about who else to bring in.
Yeah, we actually have 6 work groups, although we tried to combine 2 pairs of 2, so we're down to probably 4. But we have the same conundrum that Penny alluded to, is that we want everyone to be engaged, and yet we need work groups to be small enough to function. And I think that's going to be the problem. So we're all going to be working on ways to get people's engagement without having to necessarily rope them into a series of meetings. So we're going to be especially looking for subject matter experts to help us out, and people who want to read drafts, who want to propose approaches. That's what we really need, rather than more people for committees. So we will appreciate anyone's input, and you can reach us through the coalition website, which would be great.
Fantastic. And I would say that also, points out something that we're hearing across the committees. So there's all these 7 committees with fantastic co-chairs and fantastic members. And, one of the themes really across all of that work is making sure that we are reaching out to others who are doing work. And Greg and Terry in particular have the advantage of, they both work at the national level across, and with colleagues in CMS, with colleagues in the Office of the National Coordinator, with colleagues in some of the professional associations that are really focused on post-acute and long-term care HIT. And so again, what we're trying to do with the coalition is say, let's build on that work. Let's go where we can, get to the starting line right away, but also be thoughtful about the longer term or the bigger picture, if you will. And I think what you'll find when we post the, final priority documents is you'll find that there has been a lot of thought given to both the short term and the long term, action plans that we're looking at. So Terry Fulmer, you have your hand up.
Thanks, Alice. And I see a great point made by Jenny in the chat. One of the things, if you know me, you know that I work a lot with IHI. And what they have taught me is waste no will. If you have 500, and I'm going to comment on that in terms of committees to Penny and Terry, you can have a core committee, and then you can have all your committees open so that anybody who wants to listen and chat in. That way you're not saying thanks, but no thanks. We had a meeting with this, back me up here, team at JHF. For the CDC, we helped them run. We had 600 people on the call. It worked just fine. And so one way to do it is have your committee, but have them open so that every person feels they have the right to join you, and they can chat in. And then we can figure out what to do with all that goodwill and capture it in another capacity. I can suggest that. It's your committee and it's up to you to do that. But we found enormous success in just saying yes to everything. Because we won't, that's a staying power thing. We'll figure out how to capture those people.
Great.
Alice, back to you.
Okay, thank you very much. And that is one of the points that we have also talked about a fair amount, which is if you are co-chairing a committee and you've got members who are very invested in this, as you've seen, if you've read any parts of the NASEM report, there are topics that are sensitive in there, and there are topics where people may have strong opinions and not all have the same opinions. And part of what we tried to do with structuring the committees the way we did initially was to build those relationships, get people comfortable talking with one another and comfortable saying what they really feel and they really believe in a respectful way, and be able to have conversations with people who don't all agree with one another. And I think to Terry's point, we've been a little bit, protective, I think, of the committees just because they've only met once or twice, some 3 times. And I think it's a really good time, Terry, to open that up again and say, could we have these be more open meetings? We have people from our communications teams who want to listen in. We have people, again, from other organizations, the ombudsman, for example, yesterday, they said, well, we're not on a committee. And I said, well, but let's figure out how we can engage you. And so your point's really well taken. And yes, your experience, the John A. Hartford experience with larger groups would be really helpful. So thank you for thinking about that. And one of our, we have our core values, equity, feasibility, collaboration, and sustainability. And those are what we have used to think about and frame the priority setting by all of the committees. But there's also a very fundamental priority of transparency and inclusion. And the inclusion is, this cannot just be about all of us because we're health professionals or we're people who've had experience in nursing homes. We would love to hear your thoughts today about how can we get outside of the nursing home network? Because, again, I was in a room yesterday, 200 people, and all of them work in nursing homes or volunteer in nursing homes. Like, we all know nursing homes to some extent. And that's one group, and they're very important. But we also have to say, what about the people who have never been in a nursing home or have not been in a nursing home in a really long time? Or, people in Congress, people in local government who don't know anything about who works in nursing homes, who lives in nursing homes. For those of you who've done work on the Hill or in your own state with the legislature, chat in or raise your hand if you want to talk about some of those experiences. I think it's really telling that so many people in Congress really don't champion, or they're not activists about nursing homes because they don't understand them and they don't know about them. So that's an opportunity. It's not lobbying. I know I'm talking about people in Congress and state legislatures, but not everything we do is lobbying, and we don't want to lobby and we're not allowed to. It's about sharing information and about raising awareness and about educating in a way that's meaningful and leads to action. It's not just like educating for the sake of, oh, now they know what a nursing home is. It's motivating them so much because of the stories that you all tell that they're going to take action. They're going to co-sponsor a bill that's really going to be something that we want to see happening. And yes, Donna Dineski, it is about advocacy. Donna, do you want to jump in and say a little bit more about that? Because I know you've been active on the coalition, and you're active in your other work as well.
Sure. I'm just thinking. I actually started back doing cancer patient advocacy eons ago, and what I found on Capitol Hill is, with 1 in 4 families being affected by cancer, it's personal. And making it personal, we know it's personal to everybody on this call, otherwise you wouldn't be on it. I think it's that connection that turns advocacy into action on Capitol Hill. And I think ways you can, I think what you're talking about is trying to figure out how to crowdsource all of these interested parties into moving in a direction once we are able to frame it all up with the experts here and on all the committees and everything. So I just think it's inviting people in to make that personal connection and understand that we've got a lot of people, baby boomers keep getting closer and closer to making that silver tsunami that we've heard about for years a reality. And I think having been through the pandemic, everybody has a new sense of what it's like to have to take care of people, and leveraging that for making sure that this section of the healthcare system is part of the whole healthcare system. So I think it's certainly inviting in those connections to the other parts of the system and to those who have people in their lives that they need to care for or will.
Terry just chatted in about Terry Fulmer about, maybe we set up a page on our website for people to share stories. And we've actually talked a little bit about that with the comms team. I'm going to bring it back to them because, some of those can get cluttered and they need to be managed and all of that. That's not a reason not to do it. And Donna just gave great, some great thoughts on that. And again, the statistics and the data and the charts, we can do as much of that as we need to. And some of that is really important, but without the stories, without the personal and compelling, ideas, it's not going to move forward. But Jay Sackman, you've got your hand up.
Yes, I'm just responding to the remark that you made about experience in advocacy. I've done some advocacy in Albany, in Trenton, in Washington, D.C., and none of the people I've ever spoken with have ever spent any time in a nursing home. They don't know any people who work in nursing homes. Very few of them have had relatives who've worked in a nursing home. But the reaction has always been, I think, it's the third rail, because every solution costs something and the money is already being spent on something else. And if we can come out of here with recommendations that there's some cost justification for, either reducing cost or being cost neutral, so that it's not just a bunch of asks that will cost either the state or federal government more money, I think that we could make some headway.
Jay, that's interesting. Right now, I heard today, and Terry O'Malley will know better than me, that hospitals are going to get a per diem for every day that long-term care people who need post-acute care can't get a bed. So hospitals never have any trouble asking for extra money, and they get it. And so I couldn't agree with you more. I just think that nursing homes have never used strategies that they deserve additional, where hospitals have no trouble with that whatsoever. And so there's money out there. There's $3 trillion. It just needs reallocation. And I know that's not popular, but Terry, what's going on with that per diem? Do you know?
I don't know the details, but the general principle of engaging hospitals are probably one of our most important partners in the nursing home venture, because they're directly affected by everything that goes on in nursing homes, whether it's readmissions, whether it's inability to get a bed, whether it's lack of staff. Hospitals have something to say and to contribute. So maybe we need a hospital committee somewhere that just engages them across the board.
Or one prototyping hospital like Mass General. Mass General's been in the news a lot about this issue recently, and where you work, and so that would be pretty good. But one state, we learned that Vermont has the fewest number per capita of nursing homes, where you can really get your arms around it and figure out what's going on. But if you had one that could teach you something, back to you, Alice.
That's very helpful. Greg, did you have your hand
up? So something, I feel like many of us have sort of been beating our head against the wall for many years, sort of saying, the same things we're talking about now, is that nursing homes are left out of the scenario. Hospitals get it all, and I hear that from many of our subject matter experts and just different people that have talked to us through our committee and through when we were developing the NASM report. But I think to change, we can't get frustrated by that language. We have to keep moving forward, which is what this coalition is. We have to keep reminding people that this sector of healthcare deserves the attention that it needs. And I've had people tell me that they're very frustrated and they don't want to participate because they feel like it's not going to go anywhere. Well, that's not really good. We need people to continue to push forward and to, even though it's hard, even though you're saying the same things, you feel like you're not being listened to. It's very important that we continue to beat on this door, because eventually, I believe, somebody's going to listen to us. And especially if we get enough people, especially important people like you all, who can help carry this message to different sectors so that it gets more attention. So I think that was the mission of the NASM report, is to generate that kind of enthusiasm and build on it, and to overcome that vernacular of what the stigma behind nursing home care is, and to try to change that. And so we rely on you to help us do that. And so I just want to throw that out there.
That's very, very important. And again, I just came from a group where there were people who they're not on board yet, and they were very clear about that. And then there were a whole bunch of other people who came running up to us after the presentation and had lots of things to share and stories about how they are involved with the work already. We've overall had a really good response from ombudsmen from all over the country, and from ACL. But to your point, Greg, there are people who, there are nursing home owners and operators and others, so not calling them out specifically, but sometimes conversations that involve those groups, are become focused on, the survey process is punitive and we don't have enough money. And that, the conversations just tend to go back to that. And for those of us who've been doing this a long time, which is many of you, you may or may not relate to that, but I think a lot of people do. So how do we promote conversations and actions that get us past those kinds of discussions? Because we don't want to just go back to that. It's circular. It just goes around and around. And it's not that those things aren't true to some extent, but it just short circuits the ability to really move forward, as you said. So I do think that some of this has to be about us thinking together. So how do we have those conversations with people? And, Greg, your point is, sort of saying, well, for some people, we're not going to convince them, and that's okay. We knew that there would be some people. And then there are these people, though, who are in a little bit of transition, and they probably can be convinced, not having their arm twisted, but just convinced through conversation, evidence, data, literature, and the need and the desire to really make this happen. Some of this is just about not getting mired in these same old conversations, but moving forward. I wanted to circle back. Mary Lou, I see you on camera now, and you've raised a couple of good points here now. One is if you wanted to say a little bit more about the person-centered approach that you guys have. And then you also said a little bit about, sort of social media or how we reach people, and communication. So would love to hear about either or both of those topics from you.
Thank you, Alice. Just quickly, I was just getting ready to put in the chat also that, Greg, I feel like ageism is such a root cause of the stigma and the lack of urgency that most of society feels. So, maybe there's a way for the coalition to leverage the work that's the Reframing Aging Initiative, with which I've been involved for several years. So that's also something for you all to consider. And just quickly on the designation of excellence project. So we're 2 years into a proposed 4-year project, but we've made a lot of headway. We cast a really wide net over the literature and did a lot of data collection from all sorts of stakeholder groups. And what we have at this point is, basically a designation of excellence achievement process that is a lot of learning, reflection, self-assessment, and then strategizing. So we're getting ready to, the content is there, we're building it in an online learning management system. And then year 3 next year, we're hoping to pilot it across the country, the full designation achievement process. So it's looking very hopeful. And as I said, I would love to share it at some appropriate time with the committee that's working most closely on person-centeredness. It's very exciting.
Well, you've got Penny Cook on the call today. She's nodding, I see. So that's great.
I'm hearing that, Mary Lou. Thank you. We'll have to connect.
Yeah, that's wonderful. And I just wanted to circle back to the thoughts a few people have put in here about social media. So we have not yet gone forward, but we are in planning phases, and we talk every week now with our communications folks about social media. So I'm interested in what you all think, and what you all think is reflected in the literature. And, we have some opportunities through Facebook, Twitter, name all the other ones that I don't use. But we really do want to move forward with social media. We think a lot of people get their information that way. So Nancy Stevens, you have your hand up. Please go ahead.
Hi, can you hear me okay?
Yeah, you sound great.
Okay, great. Hi, it's such an honor to be here with all of you, just brilliant minds and caring hearts. I'm on the resident committee, and I just have a quick question. I hear phrases sometimes like bad actors or, community culture and things like that. But there is a lot of I guess you can't teach character is what I'm trying to say. Where are all these people coming from that they end up together in these facilities? And I heard so many facilities have their family members working in each and every department, so that there's that it's almost like a mob mentality. That's in these facilities with the money that's set aside to help with the workforce. I don't know how we can teach a kind of character that's caring and honest, people with integrity, those kinds of things. Like, how do we, we're not just looking to to have a bunch of bodies just fill positions. We have to have a much higher standard of, people with integrity and good character, moral values, things like that. What's the interview process like? Are there personality questions or, things like that? There's also the risk of bringing in people from, and I advocate for low income, for the impoverished, for people who are more dependent on social resources and things like that. But there's also a lack of, I guess, just basic hygiene knowledge that's not there for the staffing that's already in place. So thanks.
Thank you so much for raising those several issues, all interrelated and all really important. I think, the very, very different ways that we might approach the need for training on things like basic hygiene, cleanliness, et cetera, versus what you talked about, in terms of sort of personalities and how people interact and their interpersonal skills and abilities. And how can you, if you can't teach that, how do we deal with that and the hiring practices? So many things that the committees are working on. The workforce committee definitely is looking at, hiring, recruiting, retaining, sustaining, and supporting staff. And they're looking at certified nursing assistants in particular, because those are the people who spend the greatest number of hours every day with residents. But that doesn't mean that other, roles like nurses and pharmacists and, physicians aren't important. Of course, they all are. I think you're bringing up something, I think, at least to me, and, other members of the coalition may want to chime in. I see we have a few more people who've joined who are on the coalition now, Lizette and others. I would just say we really need to continue to hear the voice of people who are living in nursing homes now and want to share their ideas and their reflections. And that's how we're going to move forward. If we, get too far away from the actual day-to-day work. I mean, I don't go into a nursing home every day anymore. I used to when I was in practice, but I don't anymore. And that bothers me. And so we need people who are really close to the work and people who are the recipients of the care and can help us direct the person-centeredness and advocate for the role of nursing home residents and families and caregivers when it's appropriate to involve those people. It isn't always, but sometimes it is. So thank you very much for those comments. That was absolutely great. And I want to ask, I see we're almost, we're at 2:42. So we have 17 minutes left. I want to ask if anybody who has not spoken yet would like to say something related to the coalition work. And it can be anything. It can be an idea that you have or that your organization has that you'd like to bring forward, like Mary Lou, as Mary Lou did. It can be anything else that you're thinking or any recommendations to us. I'll actually, Jay Sackman wrote in about equity and diversity. And are we specifically and consciously looking to involve diverse communities, people who are from Black and Brown communities, minority communities, either in terms of nursing home staff members or, and more importantly, nursing home residents. We know that there is some literature that suggests that people who, nursing homes that have a higher population of people on Medicaid or racial and ethnic minorities for that area, often have lower quality scores and that there are other issues related to social determinants within the community. So we are focused on that, and we're not where we need to be yet. So we need to really continue to recruit from those communities. And when we get into the testing phase, so I was on my little soliloquy in the beginning, but I didn't get all the way to the testing, which is after we have the action plans and as part of the development of the action plans, we're actually reaching out to nursing homes, legislators, communities to get their partnership on the next phase, which would be the testing of the action plan. So let's say, there's something, just because Penny's on the call and Mary Lou, and we're talking about person-centeredness, maybe there's going to be some sort of action plan that's going to look at some piece of person-centeredness that we want to test. We would perhaps be looking at 1 or 2 or 3 nursing homes to do that testing. Again, this is all hypothetical because we haven't developed the action plans yet. But, then we would say, okay, how can we do this in specific nursing homes that have a high minority population or a high number of Medicaid residents, things like that. So Jay, you're on it, and don't let us forget to keep doing this because, we really do need to do it. Jenny said, great to test action plans in the real world. Well, yes, we have to, because if they don't work in the real world, it doesn't matter if they work in the lab. So thank you for that confirmation. Anybody else who has not spoken yet, and ask any questions that you have about any phases of this, or about, if anything is on your mind and you're thinking, gosh, I wonder if they've thought about that, or, here's something I'm worried about. Again, I know Cindy's on from Nadana, and we have representation from GAPNA, we have Abby. Any thoughts from either those or any other, or Ariadne, any other organizations? Nancy Wexler. You have your hand raised.
Hi, yes, thanks so much, Alice. I wanted to I'm putting in the chat from the Frameworks Institute, recommendations on communicating about nursing home care. It was a report back from April, another project that the John A. Hartford Foundation. Hi, everybody. I haven't not met yet. This has been a fascinating conversation. But it is, this was an initiative to use the Reframing Aging Principles specifically to talk about nursing home care in a more productive way, and specifically for folks like those here at the table who are the communicators about nursing homes and all the people you interact with. So to be more productive. So I just put that link in the chat. And we can certainly come back around to maybe bring some of those folks in to have that conversation or listen to your good ideas about ways to engage around getting that information out and used. Thank you.
Thank you. That's great. And I'll just second what Nancy just said. We do work with the Frameworks Institute because of previous work we've done with Johnny Hartford and, Moira O'Neill and others are really terrific, and they are helping us co-facilitate some of our sessions in December. So thanks for that heads up. That's great. Nancy Stevens, you have your hand up.
Hi, sorry, I know I've already spoken, but I'll make this quick. I was doing a lot of research on failure to thrive deaths, the rate of suicide when people get a diagnosis of Alzheimer's or dementia, things like that. And in Riverside County, we're one of the highest in the country for suicide. We are a retirement community. 90% of the residents here are mature adults. And so I had a meeting yesterday with the Riverside County Behavioral Health University Health Systems about possibly implementing they have something called Hold My Hand, and it's a suicide hotline, but there's no one there. There are peers for every demographic of people, except for mature adults or older seniors. So I had a meeting about that, but is there any research or any committees discussing the failure to thrive deaths uptick in nursing homes?
That is a fabulous question. And I don't know the answer, and I'll see if Penny or Greg or Terry have any experience on their committees, but I would imagine it might come up also on our workforce committee because, what's the impact of lower staffing and, more failure to thrive deaths could, be that. It also might come up. Oh, Kathy Bradley's on from a committee on quality assurance. And we also have another committee on quality improvement. So I would imagine actually it might come up in those areas as well. What we have, there's a lot of data now on, because of the pandemic, looking at the high death rates from not only COVID, but other things. I see Rachel not. Rachel, do you know the answer to this question? Because you might actually know the answer. Feel free to chime in here.
I don't know the answer. Just agreeing with everything that you say, Alice, is that, clinically, we've seen it so much from COVID, but so much from social isolation and really not just the low staffing, but the increase in agency staff. So the high turnover rates and the lack of relationships there. It's just a perfect storm.
Yeah. And, the social isolation deaths, of course, can be difficult to identify as that was the cause of death or contributed to the death. But for those of you on the call who may or may not know, so failure to thrive is often a diagnosis or a condition that's listed by people like myself, by nurse practitioners, physicians, others. And it isn't always what's going on. It sometimes means failure to diagnose, like we didn't find out what was really the problem here. And it's often a multifactorial, it's just a combination of a lot of things that are coming together. But Nancy's point is well taken, that if we're seeing a lot more deaths from that, it may be actually that it's due to social isolation, but nobody identified it, as such. We are really struggling also, as you all, I think, know, with the staffing being so extremely limited in a lot of areas in the United States. And a lot of people have left long-term care as a career. So something like 240,000 people have left their jobs in nursing homes. And that's across the board, whether it's nursing assistants, and physicians, medical directors, nurses, et cetera. So that's a very important committee, and we've had lots of people express specific interest in that committee. Mary Lou's also chatting in about death anxiety, terror management theory, impacting how people view nursing home care, and the impact of staff turnover, engaging or enlisting a psychologist. Yes, so it's so interesting. Someone yesterday, a geriatrician yesterday told me that she's actually developed a curriculum around post-traumatic stress related to the pandemic and related to the social isolation and things like that. And other colleagues of ours social workers and others are doing that work, because there is so much post-traumatic stress that is being seen among nursing home teams, as well as family members and residents. Jenny, Jenny Brockman, I know you've chatted in a few things, and I think it might be noisy in your area, but I just want to make sure if you want to say anything on the mic that you have a chance, and go ahead. Oh, now we can see you. Hi, Jenny.
The leaf blowers have moved away. My husband lives in a nursing home, so I am resonating with a lot of things that are being said. And there are just so many factors that have fed into the situation that we find ourselves in. The staffing is a really evident problem. And oftentimes I'll go to visit him and I'll see somebody there who I know works the morning shift, and it's 7 o'clock at night and she's working a double, and you hear them talking about working double shifts, or, they work weekdays and you see them on Sundays. So they're having a tough time with staffing. And I hear from where I work that that's happening everywhere. And that to me seems to be a very fundamental problem. The other issue that I think it really boils down to is money. Medicaid doesn't pay nursing homes adequately. The facility my husband is in just got sold to a different private equity firm, and they're hopeful that they're going to restore it to its former glory. But, we know that's not generally what private equity firms are successful in doing. So it's hard. I was very excited in the report to see the concept of a federal benefit being raised, and I'm sure that will be difficult to achieve, but so many people need this kind of care. I couldn't continue to work if my husband was not in a nursing home, and I need to support myself. I'm not retirement age. We don't have children. So there's that economic argument too. I don't know how broad it is and if it, would sell with funders, but there is a loss of brain power and potential GDP or tax revenue from people who choose, maybe not voluntarily exactly, to leave the workforce to care for someone. And then it gets to a point where, you just can't do it yourself anymore. It's too much. So those are all thoughts.
Yeah. Well, thank you again for your personal story. And I think that, what this call is generating for me is renewed belief that it matters that we're all on these calls together, that it's not just, researchers on a research call, clinicians on a clinician call, family members on a family member call. Like, we might do some of that because there could be value to some of that. And I'm not saying we won't do any of it. But there is incredible value in all of us being on a call together. We've heard from a nursing home resident today. We've heard from a couple of family members. We've heard from researchers, clinicians, advocates, and people who are part of other organizations, and people who are on the coalition and people who are not on the coalition. So just in wrapping up here, there's 6 minutes left. I wanted to say, Terry Fulmer pointed out, we did not have an agenda for today. And that was intentional because we didn't know who was going to join the call. Honestly, we didn't know if anybody was going to join the call. So this has been a really good call. And I would say going forward, we could come up with a very brief agenda before these coalition conversations, and we can talk through things like any of the topics you brought up today. So we could go back and have a coalition conversation that's just about family caregivers in nursing homes. We could have a conversation that's just about HIT in nursing homes. We could have a conversation that's just about advocacy and activism. And what are we going to do to get people around this country really angry about when things are not going right or not going well, to the point where they're really motivating action on the part of Congress, states, whomever needs to take action to get things done, and motivating nursing homes to do things differently. We've got lots of nursing homes involved, and they need to be involved. We've also got lots of advocates involved. So my question to all of you is, what do you think? We don't want to discourage anybody from joining, which was partly why we kept the agenda, really open today. And I think this was a very rich and valuable conversation, but we want to continue to get more focused as we go along in time. We're going to have these priorities. We already have them. We're continuing to refine them, but we're going to have more finalized versions and be able to share them. We're going to post them online so anybody in the public can comment, any of you, anybody else. And then, once we have them revised, the action plan, outlines will be taking form, and we'll be really building very, in a swift and steady way towards some testing that may begin as early as May or June of 2023. So that time is going to fly by, and we're going to be there. So I'll stop talking. We have 3 minutes left now. Please, raise your hand or just, let us know, shout out what you think. Is it a good idea to have an agenda? We could also go for a couple of more calls without an agenda and then figure out from there what we want to do. Sherry?
Hi, I'm from the private sector. I have a lot of experience as a director of nursing for nursing homes, but I'm currently working in risk management with general and professional liability insurance, and I handle a lot of claims. I can definitely participate with the subject matter expert because that's in line of what I do. I was just wondering though, if the changes that we are trying to rally towards is something of a change in structure or a change in the way nursing homes are looked at. I'm very frustrated. I'm a registered nurse. I've been a nurse for so many years, and many years spent in the nursing home, going into claims, going and looking at the legal system. I'm very frustrated in the fact that a lot of people seems to have the wrong idea of what we do in nursing homes and the wrong perspective, even the staff, even the patients. So I was just wondering if there would be something we could do to explore a different perspective. Not everything is bad in nursing homes, and definitely I know for sure that for a lot of people there's no other alternative to go anywhere but to the nursing homes. And I know we can challenge the state, the government, the feds and everything, but maybe we can also provide some transparency to normalize how people in the nursing homes are. The patients, there's so much wasted with the patients in the nursing homes going in there, not doing anything when they could be very productive citizens. So maybe we can change the way patients' activities are actually in the nursing homes, allow them certain liberties, because the rules in the nursing homes that guides the running of these institutions are very limiting. They bind people's hands, and they could not really do as much.
Right. Thank you so much, Jerry. So we should follow up for sure. You've got great input and insights, and having been a DON is really just invaluable to us. So thank you. I just want to wrap up because I'm sensitive to people's times. I know everybody's got another call at 3, I'm guessing, but thank you all so much. This was really helpful to me and to our teams. I want to thank Penny and Greg and Terry for joining and being available to listen and lead as they always are. Thanks to the John A. Hartford Foundation for all their support. And we will think more about this. I have another one of these calls at 7 tonight. So that's my bedtime. So I'm going to try to stay up, but really appreciate everybody's feedback. And, send me an email. Just send me an email anything you didn't get to talk about today. And we hope you'll join again and send us your ideas. So thanks, everybody. Have a great rest of your day.
Bye. Thank you so incredibly much.
Oh my gosh, you are just a gem. And I've been emailing with you a little bit back and forth, but there's just so much we can talk about, Nancy. And can you remind me what state and city you're in?
Sure. I'm in Rancho Mirage, California. It's just outside Palm Springs.
Got it. All right. Well, sadly, I'm in Boston, so I'm very far away, but
I'm a masshole too.
Oh gosh, really?
I
Oh,
am. Yeah, my
goodness.
whole family lives out there. I'm actually looking into transferring to Connecticut.
Oh, my goodness. Well, your comments, I mean, I know, people didn't necessarily get to read all of your very last comment, but we need to hear more from people like you. I can't tell the same stories that you can, and which is, very tragic for you that you've got stories that are not about the best care or, outcomes, but you do have this role as an advocate, and, that you can really change other people's lives. In significant ways. So, that's of course up to you if you want to take that on or not. And, it's all good because you have things you want to do with your own life too. But anyway, let's for sure find a time to connect. I've got your information and I'll reach out. And I'm sure my colleague Isaac, he wasn't able to be on the call today, but he'd be very interested in hearing from you as well.
That's wonderful.
All right,
Oh,
listen,
so
take
thrilled.
care. Take care.
care.
Thanks a lot. Bye.
Bye-bye.